Hello, I'm the Reverend Dr. Colin Bosson, Senior Minister of the First Unitarian Universalist Church of Houston. And as part of our online forum series, we're interviewing Dr. Kim Waller, who is an epidemiologist at the University of Texas Health Science Center at Houston. And as part of today's forum, we thought we would let Dr. Waller just give us some advice on how to keep safe during the coronavirus. And if you find this helpful, we hope that you'll watch the rest of our forum.
Thank you, Reverend Bosson. I'm going to start and go over what the recommendations of CDC and other agencies are, and then I'm going to follow up with some of my own thoughts, which are not necessarily on the websites. So let's start with what the recommendations are from CDC and the Health Department. So perhaps the biggest one, the biggest message is the hand washing. Make sure you have watched the video about how to properly wash your hands to cover all the surfaces. That's an important video to watch. I actually hadn't watched it before the start of the epidemic, and it's very helpful. So watch that and wash your hands as frequently as you can. Wash your hands whenever you think they're dirty, they should be washed. The second most important, I think, is if you are sick, or even if you think you might be coming sick, stay home. It's really going to help you. There's two reasons to stay home immediately. If you stay home and rest, you probably don't have the novel corona right now in Houston, but if you stay home and rest, you're going to resolve that respiratory infection so much quicker, and in the long run, you're going to save yourself time. You're also going to make sure that if it does turn out to be novel corona, that you haven't infected anyone. So at the very first sign of illness, a sore throat, a runny nose, don't be out and about. Stay home and rest. I think that's very important. Of course, we're limiting gatherings to 10 people or less. We're keeping social distance of 6 feet if we can do it. We've shut down our businesses here. We are not yet on shelter in place in this county. We are running virtual meetings. We have a virtual church service that Reverend Bosson is, and our other minister, Scott Cooper, they've been doing a wonderful job of that. So you can watch the virtual church service. Don't touch your face with unwashed hands. And my most important concern, where I think there's a gap, is the lines of transmission between little children and their older people over 60, which would frequently be their grandparents. My sister is in that situation, and I'm concerned about it because she's living with her grandson and her daughter, and her grandson is going to a small child care where he may acquire the virus from other children. And so they have to be very careful. It's very hard with the 2-year-old, though, because you can't really stop changing their diapers or holding them or feeding them. And I'm looking to hear from people in that situation about creative solutions. I think we need to talk about specifics. Now, I recommend getting a lot of sleep right now, because sleep will help you from getting. The studies have shown that getting sleep and getting exercise can both help you prevent getting symptomatic respiratory illnesses. Of course, we have no studies on novel corona yet, but we have studies on influenza and others. The novel, now I want to change gears and talk about some of my own ideas. We know that the virus multiplies in the back of your throat initially. And then after a few days, it's going to usually go into the lungs. I think that gargling with warm salt water is very effective when you have a sore throat, and even if you don't, because what it can do is help relieve the pain. My throat gets scratchy from my asthma medications, and I gargle with hot salt water a lot. And I believe it also may help to diminish the number of germs that are growing in the back of your throat. Not that it would necessarily knock out the infection, but it might diminish it. It might help prevent it from going into the lungs. So I am an advocate of the very old-fashioned remedy of gargling with hot salt water, and I have not found any studies of it. Glasses, we know, can be protective against the respiratory droplets, the spray from a cough or a sneeze. Contacts can increase your risk. We know people that wear contacts get eye infections more commonly. And so if you're wearing contacts, you have to wash your hands before you put them in. You have to wash your hands before you touch them. Or you might have an alternative of just switching to glasses for a while because they are protective. You need to wash your hands before putting on eye makeup. Do not share eye makeup. Do not share nasal sprays, inhalers, toothbrushes. Do not share cigarettes, marijuana joints, or vaping pens. I wanted to give a little special shout out to sexual activity. I think it's obvious to me and any healthcare professional that sexual activity could spread this virus because you're going to be obviously very close to someone. But I'm not sure that it's obvious to everyone. So I personally think we should tell people not to take on a new sexual partner, not to have a lap dance. And even if you're living with a spouse or a partner who's infected and you're trying not to become infected yourself, then you should not be having sex. So sexual activity hasn't gotten as much play, but it's obviously a very close form of personal contact and could spread the virus. I'm going to close with talking about wearing masks in public. I wore a mask out shopping yesterday and felt so comfortable in it. I was happy that if I coughed, I sometimes cough with my asthma, I felt more comfortable. I felt safer from what I really don't notice other people out and about coughing on me, but if they did, I would have felt more comfortable. And there we have a church member who's starting to make masks. She's going to make cloth masks. They're going to be 2 layers of fabric. She hopes to make them breathable, comfortable, and washable. And she doesn't yet know if the hospitals will be interested in them. Obviously, the hospitals would have highest priority, but I want to be next in line because I want to have a nice-looking, breathable, washable mask. And I'm wondering, I mean, I don't know what CDC would say, but I'm wondering if it might be helpful to have people who are going out shopping wearing masks. And as a person over 60, I think it just makes me feel a lot safer. That is the end of my remarks. Thank you, Reverend Bosson.
Thank you so much for joining us, Dr. Waller. We really appreciate you coming with us to talk with us about how we can stay safe during these difficult times.